This week in my pediatric rotation, I'm working in the pediatric emergency department, which is definitely a different pace than newborn week. And if you haven't seen last week's video, then make sure to check it out. For my emerge week, I have 3 shifts, one on Tuesday from 8 a.m. to 4 p.m., one on Thursday from 5 p.m. to 1 a.m., and my last one is on Sunday from 8 a.m. to 4 p.m. Every other day I have off, which is nice because I can relax and study. Okay, I'm here at CHIO for my emergency rotation. I'm kind of late, so I'm trying to find a scrub machine. Let's go. To start off my first shift, I had trouble finding the scrub machine and then changing because the change rooms were so far away from the scrub machine. But once I figured it out, I made my way down to the emergency department and met up with the resident that I'll be following for the day. The resident told me that it was going to be a busy shift because lately a lot of family doctors have not been able to see their patients for various reasons, which are not in their control. And because of that, many of their patients have to come to the hospital. And the resident set the expectations for me in regards to note taking, explained how he wanted my notes short and to the point on each of the patient's file, which makes sense since it's an emergency. The first patient that I saw was a 14-month-old boy with a concern for fever, something that is not uncommon. So I went into the room, talked to the mom, and asked questions such as when did it start, how long has he had it, and so on. A common mnemonic that many people use is OPQRST, which stands for onset, when did it start. P is for provocation, and palliation, what makes it better, what makes it worse. Q is for quality. R is for radiation or region, where does it radiate to if you have pain, or what region is it located in. S is for severity, and T is for time. I typically ask these for every patient to get a good foundation in terms of what is going on. And once I saw the patient and performed a physical exam, I finished charting my notes in the main office area and then presented the patient case to the resident. This is where I quickly summarized what I learned about the patient so that the doctor has an idea of what's going on. Once we reviewed my notes together, we went back to see the patient and explained to the mother what we thought was going on. There was nothing to worry about and clarified certain situations where she should bring her son back. For example, if the fever worsens dramatically and doesn't get better within a certain time period, then they should see their family doctor. One of the other patients that I saw had a 10-day history of a rash that spread from the neck to the rest of the body. And after presenting the case to the resident and then seeing the patient, the resident turned around to me and said, "I have no clue what it is." He then proceeded to hand me a big stack of pictures filled with all the possible rashes someone could have. And I had a really hard time finding something that resembled what the patient had. But we eventually landed on something called folliculitis, which is inflammation of the hair follicle, typically caused by bacteria. The patient was prescribed antibiotics and told to follow up with their doctor. All right, it is noon. I've been in the emergency department since 8 a.m. and I've been able to see 3 different patients, take notes, present to the doctor, and kind of come up with a plan. It's been good so far. It's very difficult to get any videos in the emergency department, but it's very fast paced. But I have really nice residents that walk me through every step of the way, so I'm really enjoying it so far. I've seen a young baby with fever, another baby 6-week-old with some abdominal pain or cramping, and then a 10 to 12-year-old girl with some whole body papular rashes that it took a little bit to figure out what she has, and we still don't know. We're thinking it's like folliculitis. But now I'm gonna eat, take a break, and go back to the emergency department. This shift was so busy that every single room in the emergency department was being used. We had over 60 patients waiting to be seen, and so I ended up using a procedure room to see patients to line up the burden on the emergency team on other floors. Overall, on my first shift, I saw 5 cases, and there were poor feeding, fever, rash, cellulitis, and trauma. Once my shift was done, I went back home, cooked a meal, and then did some studying. Good morning. Today is Wednesday. I have the day completely off just to study, just to prepare for tomorrow as well. Yesterday, I had my first emergency department shift at CHIO, and this is what my schedule looks like for today. I started with some flashcards. I'm still doing them. I haven't eaten breakfast. I'll probably do that soon. Then I have pediatric grand rounds, emergency rounds. Then I do some more studying, exercise, lunch, studying, work on my business, which I have a performance coaching program, and I talk about productivity, overcoming procrastination, coordination and time management, specifically geared towards pre-medical students, but anybody benefits too, young professionals. Then I'm going to do some practice cases, chill, dinner, kind of have the rest of the evening off because I got a lot of studying done here. The trick is to really just stay focused when I am studying. Sometimes I do really well, sometimes I waver, and so it's just because I'm getting back into the rhythm of things. And that's really important that I put my phone away, I put social media away, and I just stick to the flashcards and I focus on understanding the concepts. I find there's a lot of content to go through, a lot of really understanding, because at this point I'm seeing patients, right? It's not just a test. Whereas before I could easily focus on just memorizing or recall, but now when I'm getting asked questions by residents on the wards, by doctors, I want to know exactly what I'm gonna order or what the differential is, and my mind feels so mixed. It, like, when I get asked the question, I can't think in the list because I haven't categorized those things in my head yet. It's just jumbled in there. I know it's in there somewhere. So my goal really for every rotation or a little bit each day is understanding kind of what are the differentials, how would I approach a scenario, and so that requires a good foundation level knowledge, and I get that through some flashcards, reviewing some past notes. That's what I'm gonna do today. All right, so I finished doing flashcards, eating breakfast, working out, taking a shower, eating lunch, and kind of working on my newsletter. So let me show you, if you're not subscribed or signed up to the newsletter, maybe you should consider it, because I release a newsletter. I try every week. I'm not always consistent. I just kind of include an encouraging post or social media post I created that I think is valuable. And then I upload or I share the most recent YouTube videos and kind of a podcast. This one's about nasal breathing and how it increases longevity. And so I try to do this every week. It isn't something that I'm always consistent, but I try. I don't want to spam people with emails, but I do want to kind of share any value that I learned throughout the week. And also, here's my schedule for today again. So if I go to my calendar, I'm going to get back to studying right about now. I've completed a lot of flashcards and got to get back to it because there's so much to learn. So that's what I'm going to do now. One tip that I share with students that ask me how to get more done, maybe they struggle with procrastination. Everybody does, like I even do sometimes, and it's normal, right? Don't feel like you're incapable of overcoming it. All I do is really, I do my best to put my phone away. If I get notifications, put it in airplane mode. If I still reach for it, then I put it in a drawer in another room, and I close all my social media accounts. So that way I'm only focused on one thing. So that'd be my tip for you in terms of how to get more done in less time. It's really just minimize your distractions. Once I put my phone in the other room and set my 40-minute timer, I began reviewing some flashcards. Lately, I've been having a difficult time adjusting to doing flashcards in Clerkship because there simply isn't enough time to get through the ideal amount. What I've been trying to do, instead of reviewing cards every day, I review specific topics at different times to make sure I cover a variety of topics instead of just seeing the same topic over and over. All right, I'm going to move on to do aquifer cases. And so what this is, it's a website with a lot of practice cases that walk me through situations. So they'll give me a prompt, like what's wrong with the patient, what are the next steps, what are the symptoms, clinical presentations, diagnosis. It's very interactive. So let me flip the screen here. So for example, this is one about 6-week-old male with poor feeding. Here it says you're in the clinic with this doctor and the child comes in with his parents. This is birth weight, right? The teaching point, and then continue. So I can click these and learn, and slowly as this progresses over the next 30-45 minutes, I keep learning more and more about poor feeding. And so it's a very interactive way of learning. It's not just flashcards. It's not just watching a video. Every time I think it through and I ask myself, what would I do in this situation? I do learn more from these cases. And it's interesting because yesterday in the emergency department, I actually saw a 6-week-old infant with poor feeding. So that's why I picked this case. We don't have to do all of them. We only have to do some. But I picked this case to kind of solidify what I saw in the emergency department. And so I'm prepared for the next patient that comes comes in. After we finished that session, I went back home to eat and prepare for my evening shift. All right, so I'm just getting ready to head out. I have a teaching session in the emergency department, so packing my bags, heading that way, and I'm gonna park close to the school and walk there. We don't know what the teaching session is about. I say we because some 4 other classmates going. We're just gonna show up, and it says we're going to simulation center in Geo, so we're gonna learn something that's gonna be simulated, so let's go. All right, so I just came back from the hospital, I ate lunch, and now I just wanted to give you a quick recap of what I just experienced with my friends in the simulation session. It was 2 hours long, there's 4 of us, and the way that it was structured was that somebody was the team leader, and they had to assign the other 3 people roles. So somebody took history, somebody did vitals, somebody did a physical exam, and then the doctor, she would pretend to be the mother, so we would ask her for history. She'd also give us vitals, so if we put the O2 sat monitor on the finger, we'd be like, okay, what's the O2 sat? She'd give us 95%, whatever. And so the first session that we did, we were completely lost. We had no clue what we were doing. Nobody was really a team leader. We kind of like worked together and we didn't know how to put anything on. We fumbled through it. I believe the case was like a viral gastroenteritis. So all we knew was that it was like 4-year-old patient came in with vomiting and diarrhea. So we had to come up with a differential, ask some questions, and go from there. We really stumbled through it, but it's expected because neither of us had any experience. The second case was a 3-year-old presented to the ER with respiratory distress. And so at that point, we knew we had to assign roles, which made a world of a difference. As soon as somebody knows what they're doing and they only have to focus on that, that changes the dynamics completely. We learned that the team leader should stand at the edge, at the front of the bed to kind of have a good view of everything that's going on. And so I was responsible for asking questions and taking history. And upon history, I felt like to the sounds like a Strider 3-year-old. To my mind, it came up as like croup. That's my top differential, which ended up being correct. And the other team members were doing the physical and the vitals. And so we were a lot more organized, and that makes a big difference. The third case that we did was a 2-year-old presented with lethargy. And so, what is lethargy? Is it what the parent says? It's different. It's more severe in the medical community's eyes, and the differential is very vast. So we wanted to go through that. The patient had a GCS, glass coma scale of like 8, which is not good. It wasn't too responsive. Started having seizures, and so we checked the blood sugar for hypoglycemia. Blood sugar was low. We administered 10% IV dextrose, and the patient started getting better, and so on. So that was, again, more organized because everybody knew their role, just different case. And lastly was me. I went last, and I was a team leader for this. We weren't given a history, so we were just waiting outside the door, and the doctor called us in, and she's like, all right, you guys are medical students on a field trip, and you're walking down this park. When out of nowhere, you hear a mother yell and ask for help. Her 6-year-old son has fallen and is unconscious. And so I was like, oh gosh, what do we do? So me as the leader, completely forgot we're in a park. I just stand in front of the bed so I can oversee everything that's going on. I'm asking questions, taking history, writing it down. I have my iPad with me. While my team members are doing such a great job of going over the vitals and physical signs, they immediately start CPR because the patient isn't breathing. So I was focused on my role, and I was just asking questions, taking history. And halfway throughout it, I was like, maybe I shouldn't be focused on history right now. Like, the patient's dying. He's not breathing. Maybe I should just be focused on the CPR. And I thought about this later. Anyways, for CPR for a child, it's 15 compressions and 2 breaths. And so that's what my team members started doing. And then we brought in the AED. I also, within that sequence, signaled 911 to bring the emergency. This is a classic just emergency case. I wasn't expecting it. I thought it would be like, we're in the hospital. But this is real life. Somebody collapses. What do you do? And everybody did a good job. And once the AED went off, patient was awake and doing well, right? Simulation. But that's what we went through. It was stressful because we haven't had a lot of simulated cases. So it really gets you thinking, like, how do I put the leads? Where do I put the leads? How much fluid? I want to give 10% IV dextrose. There's all these little things. Like, for the first 2 years of medicine, we're studying the theory. We study a lot. We forget a ton. Like, we forget more than we study, it seems. And then once you get into the real life, there's also the practical things. Like, how do you apply this? What syringes, which gauge of syringes do you use? It's really fun to be in a simulated case, especially when it's low stakes, like you're not being judge. Everybody knows you're kind of starting off. It's just to, show you what's going on, but it's a very valuable experience. So now I'm going to prepare. I'm going to study some more and then prepare to go back to the emergency department from 5 p.m. to 1 a.m. That's my night shift, my evening shift. And I heard it's pretty chill, but still going to be busy. So I wanted to get some studying done. All right, it is 1:53, and because I'm gonna be staying up till 1 in the morning because my shift is from 5 p.m. to 1, I'm gonna take a nap. This is my first kind of shift that completely disagrees with my normal schedule. So I wanna make sure that I have energy. Don't know if a nap will help or it won't, but I'm gonna take a nap and they're gonna sleep for about an hour and a half. And hopefully that hour and a half, gives me enough energy to continue on throughout the night. I heard it is chill, but also that I'm seeing patients. I'm gonna have adrenaline. I'm gonna be okay. So I'm not too worried. Also, tomorrow I have the day off, so I can sleep in a little bit and then carry on with my day. So peace. See you in a few. All right, woke up, got my food ready for tonight. I ate a little bit because I was slightly hungry. I don't want to be hungry on the wards. And then packed a late night dinner. Put my shoes on right now. Wearing my scrubs. I think I can actually wear my own scrubs at the emergency department. I don't have to use the hospital scrubs, so that's nice. And I'm gonna show up there early. Let's go to park and see what today's gonna bring. It's gonna be exciting. Halfway through each shift, I always make sure to take my lunch break to make sure I rest, refuel, and have energy for the second half because it is super busy. The second day went a lot smoother as I developed more confidence in seeing patients and taking better history and performing better physics exams. And at the end of every emergency shift that I have, my preceptor has to give me an evaluation, which is a quick moment at the end of our shift to give me feedback in terms of what I did well and what I can improve on. Moving on to Sunday, this was my last shift in the emergency department for peds. It always feels weird to work on weekends, and especially on a Sunday. I'm not sure if I'm ever gonna get used to that, but my shift was from 8 a.m. to 4 p.m. and it was just like my previous shifts, nothing too different. But on this shift, I was able to see 6 patients in total, and the cases were croup, asthma, fever with otitis media, which is ear pain, and an MSK injury, and another fever. Alright, I'm here at the emergency, saw a baby with a rash on her face. Took a full history. Now I'm trying to come up with a differential, which is kind of difficult because it's a rash. The doctor is fast paced because the emergency room right now is loaded. All the rooms are taken up. So I kind of feel bad that I feel like I'm slowing things down, but it's part of learning, being thorough, writing out my notes and being able to present. Now I'm just trying to look up what causes a rash around the eyes. Alright, I just came back from what the doctor put in is sutures on a patient's head, an 8-year-old head from a car accident. He was fine, he was kicking and screaming, so the nurse had to hold him down, kind of swaddle cloth him, or however you pronounce it. Now I got another patient who is 12 years old, male with abdominal pain, thinks it's constipation. So right now I'm running through my differentials and kind of questions I'm gonna ask this patient to make sure that I cover all the bases. Once I have that, come back, present it to the doctor, and we go back in. So for constipation, it's hard to tell. I'm gonna ask about diet, drinking enough water, any medications, any changes recently, what happened, when this started occurring. So this is the first constipation case I've had, so I was looking at my iPad for things to look out for. All right, time to go see him. All right, so there's a patient who is 14 months old presenting with fever. And so what I'm gonna do is I'm gonna go on this website called Learn Pediatrics from UBC. And here they have a nice approach to common problems and approach child with fever and a rash, some other options. And so I just kind of look through what kind of things I should be looking for. If it doesn't have it here, then what I do is I actually search it up on an app called dynamed.com. It's also a website. And then I look at kind of the questions I should be focusing, the differential diagnosis that I should be thinking about and worried about that I want to rule out for this patient who's 14 months old. So that's what I'm going to go do now, and then I'm going to go see the patient. All right, so we just saw a patient with resident, a 14-month-old infant who had signs of fever, runny nose, coughing. He's a little irritable, got to do a chest exam, respiratory exam, asked the dad some questions. We noticed some redness in both ears, but we just think it's a minor cold. He's congested, which can kind of cause some swelling in the ears, but it's not an ear infection. Not enough signs and symptoms for us to be able to diagnose ear infection and prescribe antibiotics. Probably the one that's screaming in the background. Next up is most likely see a laceration with the doctor, suture the patient up. But yeah, so far so good. It's 10:41. I am feeling a little bit tired, but I'm learning lots, writing notes, asking questions to the resident, talking to the doctor. So this is very beneficial. Looking forward to tomorrow though, where I got the day off and I can just focus on studying, really solidifying what I see today in the emergency department. But it is 10:42 and there are about 49 patients in total waiting. It's a bit lower. When I started, it was over 60. So the emergency department is full today. All right, got my orders. Next patient is a 6-year-old patient with some vomiting, abdominal pain. So I'm gonna learn more about what causes that. All right, guys, so it's 12 in the morning. I just saw a patient, little 6-year-old with a possible UTI, abdominal pain, and I'm tired. I'm getting really tired. There's always a baby crying. There's always things to do, a lot of thinking. I don't know much, so I have to do extra processing around some of these cases and differentials, but things are going well. Okay, I saw somebody with a croup. 5 years old, and I just saw a 8-year-old male with some asthma exacerbation, coughing. So currently waiting for the doctor to present my case and do a workup and see what we think it is. I don't think it's asthma, it's just coughing, but so far so good. It's 1 o'clock in the morning, just walking out of the hospital right now. Gonna go to the car, drive home. I'm gonna enjoy a really good night of rest. Man, today was busy. The doctor's saying we didn't see as many patients as we could have. We were a little slow, but the ER was just booming. Lots of people, but overall really good, insightful. Lots of fevers, vomiting, abdominal pains. I feel so sad for the kids and parents that have to wait for so many hours. One of the biggest problems is that a lot of family doctors aren't seeing patients because of the COVID protocols or precautions, and so many patients can't go to their doctors, so they come to the ER, and that results in them having to wait for 7, 8 or more hours. Overall, I really enjoyed this past week. Emergency is fast-paced and you get to see a variety of cases in a short period of time. It's unfortunate that I only get 3 shifts in it, but it was a great experience. One of the things that helped me the most during the busyness of clerkship are the high-performance skills that I developed over the past 2 years that have allowed me to balance medical school, YouTube, and podcasting along with getting married. And that's why I've decided to create a high-performance program that helps students get more than 10 hours back in their day while overcoming procrastination and being able to spend more time with their family and friends. So if you're somebody who's struggling with procrastination, feeling like they're falling behind in their studies, not being able to exercise, not being able to study effectively or spend time doing things that they really like on top of studying and doing well in your exams, then let me know in the comments, message me on Instagram, send me a DM with the word impact, because you want to increase your impact in life and you're tired of being weighed down by the busyness of life. And what we can do from there is jump on a free strategy session and talk about how possibly my program can help you out if it can, just like it helped some of my students. Just check out their testimony right here on the screen. Many of my students have been able to save over 8 hours, over 10 hours, and up to 13 hours back of their week so they can spend time doing other things that matter the most, and their anxiety decreased, they dropped procrastination, and they become high performers in less than 4 weeks. But the program is 8 weeks, and I know you would enjoy it if you join, so let me know on Instagram or in the comments down below. That's it for this video. I hope you have a great week, and I'll see you in the next one.